Hey everybody, Dr. Eric Herman, Guru Chiropractor, back again for another video. Peace and love to everybody out there. This is my newest patient, Big Jonathan. Give me some of that.
Yes, sir.
He drove all the way up from Philly. Is that an hour and a half to get here?
Yes, sir.
Well, I appreciate you taking a ride. I always say that, but I'm sincere about it. The average chiropractor really pulls from 5 or 7 miles around their office, right?
Sure.
So when people drive far, it still kind of freaks me out a little bit. Since I've been doing the ring dinger, a lot of people are doing that. I'm going to do everything I can in my power to make it worth your trip.
Okay.
That's what I'm going to do. I can't promise results, but I promise you I'm going to work hard today to help you out.
I appreciate you.
Yep. So he came up. He's been a ring dinger fan, though, even before he's found me, right?
Yes, sir.
And then you saw that I'm around, so you didn't have to fly to Houston.
Yes, sir.
Sorry, Dr. Johnson, but you trained me.
Stole a patient.
Yeah. So I love patients like that because he's already educated about what the ring dinger is. He already knows he needs it and wants it. So it makes my job a little easier. That's cool. So basically, let me pick up my my history. We didn't do an exam. I'm going to do an exam on camera. Usually I don't, but today I just feel like doing that. But we did a health history, and basically he told me he's got sciatica on the left, and sometimes it flips to the right. Right now it's about a 4 out of 10, but it jumps up to 6 or 7, right?
Yep.
And it's been going on for 10 years.
It is. I was a
And since you're younger, because you're already young, and it's getting worse.
Yes, sir.
And you tried some other chiropractors, or
Yeah, I have been the same twist and turn.
yeah, like the normal routines they do. Didn't it really help?
No, sir.
Yeah, sometimes, especially when you have a pinched nerve and you have a disc issue, you need that decompression. That's what I'm starting to see since I've been doing it. It's like the missing link that not a lot of chiropractors do, but once you add it in, it gets it done.
Yes,
so hopefully that'll be you today. Hopefully you'll be walking out doing somewhat better. I'm gonna work my ass off today to make that happen.
Sounds good.
Also, what else did you say? Middle back, you got some stuff going on too. Mid back pain,
a little nerve.
and like on that left shoulder blade, in between the shoulder, like the muscles in between the shoulder blade and the spine in there.
Yes, sir.
And it's worse when you cough.
Yep.
So I'm suspecting a rib joint because that's classical symptomatology for the rib joint. You know, the ribs wrap around the back and the front, and when they in the back, they actually attach to the spine. There's little processes that stick out sideways on the vertebrae. They're called transverse processes. And when the rib comes around, it attaches, and sometimes that gets jammed up. And that's exact symptoms of a rib joint out. So I'm going to check for it in the exam. If it's that, we'll adjust that. Should help you out a lot. And that's basically all the symptoms, right?
Yes, sir.
Plus, I'm going to see what else is going on that you might not be aware of. And then if I find anything else that I think needs it, we're going to handle that too before it gets worse. All right, cool. So let me put this down. Scoot over a little bit. I'm going to come behind you. I'm going to do a neck and shoulder exam first. And then we'll lay you down and we'll look at that lower back, which is where probably the sciatica is coming from. So from this point on, anything I'm doing to you, if it don't feel right, please let me know right away. I know you're a big, tough dude and you can handle it. Yeah, no, but it's important doctor stuff. So just let me know if it causes any discomfort. Otherwise, relax and I'll do my job. And hopefully we're going to find some stuff and then we're going to fix it and you're going to be walking out and driving home feeling better. That's my goal. That's my intention. And that's what I'm going to work hard to make happen. So neck-wise, not too bad. I feel a little bit of tension in your trapezius muscles, but everybody's got some of this because we spend too much time looking down at the phone, driving. It makes this really a lot tighter than it should. But it's not horrible. So now I want to see how well you're turning. So you let me turn you. You be passive. But if it starts hurting when I get to a certain degree of turning, let me know right away. Okay, so let's turn to the right. See how it's kind of getting tight right there and stopping? Normal, look, are your eyes open? Normal, the nose should go to almost your shoulder. So that's about a 15, 20 degree impairment. When I stretch it, does it hurt or it just feels tight?
No, just tight.
Okay, go the other way. Yeah, see, that's worse. See how it stops right there? Mm-hmm. Should be able to go here. That's about, I'm approximating about a 30, 40% impairment. How about if I stretch it? Where do you feel it?
My back left.
Here? Yeah, here?
Kind of in my neck.
Yeah. All right, come on out of that. Now I'm going to tilt it this way. Anything painful? No. Okay, tilt the other way. Anything painful? No. Okay, go backwards. Anything feel jammed up? It goes nice though. It goes far. What are you feeling?
Like in the back of my neck.
It's jammed.
Mm-hmm.
Pain?
Like a 2.
All right, get out of that. Any dizziness when you're back that way? Good. Chin forward as far down as you can go. Is that pulling anything in here?
Mm-hmm.
Yeah, come on out of there. All right, now I'm going to do what's called a cervical compression test. Basically, I'm just going to push down on your head. Nothing jerky, just a little push down like this on your shoulder. If that makes anything here in your neck or in your shoulder blade or even in your lower back feel worse, let me know. Stay relaxed. No? Yes? Okay, let's do one side at a time. So come back a little bit, go this way. Ouch.
It's like a compressed feeling. Like
In here?
Yeah.
On this side, right?
Yeah,
because that's the shoulder blade side. Let's see if it does it on this side. Nah. Yeah, so clearly there's definitely some compression here. It's probably shooting. That's what's causing in here. All right, now I'm going to do the opposite. I'm going to stretch your neck up to do a little decompression. Let me know how that feels. I like it, no different, or I don't like it. Stay loose as a goose. Like in your neck and shoulders, how'd that make it feel?
I ain't really feeling it.
No different. Okay, that's a valid answer. Last thing for the neck is I want to look at your posture. So just keep looking forward. Your forward head posture actually isn't too bad.
I'm kind of forcing it. If I was
Don't force.
If I was to sit regular, it'd be more like a hunch,
well, but don't force it, but sit kind of normal. But still, your head's only popping forward about a ½ inch. I mean, it's still significant, but I'm talking about, I got guys coming in here 3 inches, 2, 3 inches, even 4 inches. That's real severe. So that's probably mild to moderate. We'll check it afterwards. If I do a good job, that should get even better. All right, now let's go ahead, lay down on your belly, put your face in there, rest your hands on the side cushions. Get yourself relaxed. Are you comfortable? You good? Slide down a couple inches towards your feet. Look at them tats. I like checking out people's tats. All right, I'm just looking at your posture as you lay here, because sometimes that gives me some information to work with. Boop, boop, boop.
Before you start, like just
Pulling on that left side. Here?
Just like right down like this.
In the center or more on that left? Center. Yeah, so that's probably some compression. I don't see too much of a deviation in your posture. Hips are level, not too much of a twist. A little bit of twist in your shoulders. Not too much, though. A little bit of a twist to the right, but not horrible. The camera probably won't even pick that up. I'm going to do a couple orthopedic tests for your lower back. So the first thing we're going to do is just bend up your knees, right? Normal, you should just feel it stretching your front of your thighs, right? That's a normal occurrence when you bend up your knees. However, if you feel anything pulling extra here, getting tighter in your lower back, or hurting more here, let me know, okay? That's not normal. Ben, as I stretch up, anything going on in your lower back? What's happening?
It just got mad, like a lot of pressure.
Like more pressure? Where? In the middle or more on one side or the other?
Middle.
Yeah. Okay, so that's a positive orthopedic test. Ouch, too?
Well, it was like a stinger almost went up on my feet.
When it went down, yeah. So right here? So that's an indication that there's too much compression in your lumbar spine. Already I know you got compression in your lower back, so the ring dinger is going to help this a lot. When I'm pushing on there, does it hurt at all?
Yeah, like a 4.
Both sides?
Yeah,
Okay, how about here?
definitely. Ooh,
What number?
that's probably like a 5.
Yeah, so there's definitely compression and there's inflammation. When it hurts, that means there's also inflammation. Some people just have compression without inflammation, but when there's inflammation, it's worse. Now we're going to check the sacroiliac joints. That's the joint that connects your tailbone with your hip bones. There's one on each side. So I'm going to just put a little bit of pressure down on your tailbone, kind of like just to stabilize. Then I want you to start with your left leg, right? Don't bend it. Keep it stiff. Keep a straight leg all the way down. Lift it up off the table as high as you can. Go. Okay, go drop it down. It went up pretty nice, but did it feel anything abnormal? Did it hurt or
I
pull?
forced it to go really high.
Yeah, but did it hurt when you lifted?
Yeah.
Okay, try the right side. Yeah, and down. What'd that feel like?
Less pain, but I still felt something.
Okay, so worse on the left? Yeah. And that's where you said the most active sciatica is, down this way?
Yes, sir.
Makes sense. All right, so you definitely have some jammed up sacroiliacs. Not horrible, but it's definitely worse than normal, and a lot of compression in your lower back. The ring dinger is going to pull that out, man. You're going to see. You're going to feel like, I hate making predictions, but I think you're going to feel great afterwards. Okay, right here in this area, this is kind of like the transition between your middle back and your lower back. Feels a little pressure. Is it sore or just tight?
Nah, just that.
Not too bad in here as I come down. Not too bad, but once I get here, there's a lot of pressure. Can you feel?
Yeah.
Is it sore too or just pressure?
A little bit of soreness.
A little bit, yeah. There's a lot of compression in here. You say you drive a lot?
I used to.
Yeah. Sitting, driving puts a lot of stress right in your, what's called the transition area between your neck and your shoulders. Big, big, big time hot spot for spinal problems. Is that sore when I'm squeezing on the right?
A little bit.
How about on this left side? It doesn't feel as, huh?
Just a little bit. It's not.
Yeah, it doesn't feel that bad. Okay. How about here, right here? Nothing? It's a little tight.
Yeah, it's just tight. It's no pain.
Okay. All right. So basically, major issue is here and here and here.
Yes, sir.
All right. I'm done with the exam. Nothing showed up for contraindications, meaning it's safe to treat. I definitely feel good about treating you. I think it's going to help, and it's definitely safe. So I'm ready if you are.
Yes, sir.
Full spine, full body adjustment, and ring dinger is my best recommendation. You know the fees?
Yes, sir.
You good with it?
Yes, sir.
All right, let's do it. So the first thing we're going to do is I'm just going to loosen you up with a little of the ring dinger, of the thumper massager. I'm going to do a little massager here and a little stretch just to loosen you up. First, I'm going to raise up the table. Hold on. Raising you up. Woo, wrong way. Do you know I do that almost every time? Every time I hit the wrong button for my table. I'm just telling on myself because that's a little bit.
That felt crazy.
What happened when I lifted up the leg?
No, like the first position, like the stretch in my spine.
I just lifted you up a little bit because so I don't have to bend down too much because then that messes my back up. So we're going to use what's called the thumper massager. If you don't like it, let me know, but I bet you're going to like it because everybody loves this damn thing. If you start snoring, we're going to film it. Actually, hold on. I got to turn this heater off because I'm cooking already. All right. Does that hurt when I was doing that?
Nah, it hurt.
Yeah, you feel it. I just like to loosen up before we do the big stuff. Say again?
I said I felt it on my toes on the left side.
Oh, shooting down like pain or tingle? Yeah, you definitely have compression here. And it's pinching on that nerve going down. On the left toes, left side? Makes sense. Sciatica can be caused by here or by over here, pinched. Seems like it's from here based on what just happened in your lumbars. It's good? If you pay extra, I could do it for about an hour. I'm just messing around. How's it is in here? Is it sore when I'm working here? Yeah. You play ball in school or anything?
Good sport.
Nice. Because you're a big dude, I thought you might have played football.
Yeah, I was a little small in high school.
Oh, yeah? Didn't you say you wrestled?
Yes, sir.
That's right, we talked about that. Me too. Me too. And I was a good martial artist, but there was no MMA back then. Otherwise, I would have been a great MMA. I missed the boat. Just loosen it up. Let's get a little extra in this left shoulder blade. This where it bothers you? Does it hurt when I'm doing it or feel good? It's not making a sharp pain or nothing?
I mean, no.
All right, good, good, good. Just let me know if it doesn't feel good. That's right in there. The muscles underneath this, you got the medial trapezius, and then underneath there is called the rhomboid. Say again?
Right there.
Right here? Bullseye? Ground zero right there?
Yeah.
All right. Ba-da-ba-ba. Good. Just a little warm up for the bigger stuff, but some people feel fabulous even after the warm up. Not gonna lie. All right. All done with the warm up. So when you're ready, big man, come on up on your feet. We're going in that back room. Take your time, no rush, no jerky movements if you could avoid it. Now notice when they're up like this, it flattens out your lower back. It relaxes it. You feel that? Good. Now we got to pin you in tight above those hip bones. It's got to be really tight. Don't be a baby.
All right, good deal. Thank you.
Remember, you're on camera. Don't complain. Good. Boop, 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 boop. Can you handle that? Oof, you're in there. Now you can't get out till you pay. That was a joke. Give me your hands.
Yeah, you got it.
This is not the treatment. I'm just making sure there's no slack when I do the real pull. Yeah, you're good. Relax it down anywhere you're comfortable with your hands, except don't grab the bars. Now the towel goes around your neck, but really it grabs the back of your head, your skull, and your jaw, because my hands are way too small to pull good. You nervous? Keep breathing. You'll be all right. I don't pull the head off anymore because it's bad for business. I'm joking around. And then people don't pay afterwards either, so it's real good.
Yeah.
Lift up. So your job, listen, very important. I know you watch a million videos, so you probably noticed already. Keep your teeth closed together, but don't bite hard. Just keep your jaw together so when I pull, you don't bang your teeth. Other than that, just stay as relaxed as you can, and I will do the rest. You ready to rock? All right, give me a second. I'm going to get a good grip. Stay loose, baby. Loose as a goose. Get ready to be freed up. Wiggle your left toe. Boom, breathe. Woo, that was big.
Can't open my eyes.
Yeah? What'd you feel? Did you feel it all the way down?
Definitely.
Nice.
I really fucked up my neck though.
Okay. I tell everybody I can't really aim it. I just pull. And whatever really needs it is what releases the good.
Definitely.
Coming down with the legs. Don't get up too quick. Stay there because I want to release your neck a little bit more. Now, once you get flat, I want you to tell me if you feel same as you did before or different.
Nah, I could get up smooth now.
You feel
I feel like I could get up like without being stiff.
Nice. So less pulling when you're laying now flat than before. Good, 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 good. I love it. This thing is the best thing on the planet for fixing backs. Now, before you get up, I'm going to twist your neck, do a little more release.
Definitely took all the pressure off that my lower back.
Nice. Nice. Stay loose. Good. Woo, Lordy. Good. Now, whenever you feel ready, if you need a little time to chill, that's fine. But whenever you feel ready, make your way back up on your feet. And wait. When you got back problems, the best thing to do to get up is don't sit straight up because that squishes down on the discs. Turn sideways, let your legs flop off first, and then get up that way. Yeah, then rotate. Yeah, see, that's much better to get up. Now, when you get on your feet, I want you to stop for a second, feel your body, tell me and tell the camera what feels different.
I just feel looser. Like I just felt like it wasn't like I was more compressed, and now I'm decompressed. Obviously, like
dude, that's exactly what it's supposed to be doing.
Walked in here, I felt like I was like a little more hobbled. Right after that massage. Now I obviously
like less stiff, like more of a. Your posture looks better as I'm looking at you, so that's a good sign. All right, amen. That was a good pull, and great. But we're only like halfway. Now we're going to do a lot more over there. The first thing we're going to do is redo a couple of these orthopedic tests. Actually, before even that, let me look at your posture. Not too bad. Actually, now you got a little twist in your hips to the left, but sometimes that happens. We're going to get that out. Remember when I bent them up?
Yep.
How it was pulling here? Mm-hmm. I'm going to bend it up again. Tell me if it feels the same or better, like less pull. Because these are my measurements. I can't feel what you feel. I'm not in there. You are. Mm-hmm. But these are the way I assess whether this is working or not. As long as you tell me the truth. Ben, how's it feel now in the lower back?
No pressure.
0 or less, or just reduced? Huh?
Like a 0.5.
Dude, you're doing good. Most people go from something to reduced. It's rare, but it does happen where it goes from something to nothing. So you're doing good. All right, now I'm going to do some more adjustments here. I'm going to do what's called the drop technique or the push down to release this way. So first, the belly drops down to give me some more room, the belly platform. This pops up. I got to tighten it for big guy mode. And when I push down on you, it's going to go boom. Okay? So I'm going to go boom, 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 boom. Just stay relaxed. Usually nobody complains about this move, so you should be all right. Good. Good. This is the left side is the problem side, right? Nice. Good. Change my angle a little bit. Getting that sacroiliac unjammed. Good. Now we're going to go up the spine, the lumbar spine a little bit. Good. Oof, that was big. Good. Bingo. Bingo. All right. Now your hips are neutral. Let's bend again. How's it feel now?
0.
Dude, you're doing great.
You're doing great.
Well, okay, thank you. You're responding amazing. Better than most people. Now let's do this one. Keep it stiff, lift it as high as you can this time. Woohoo! Look at that. Drop it. Do the other side. Come on. That went up like 4 times as high. That's why I did the before, because I haven't been doing a lot of the before. We missing it on camera. So people can see legitimately how much this improves your range of motion. It's ridiculous. A little bit tighter still here. How's it feel when I push compared to the first time? Remember you saying it was hurting when I was pushing?
It is. I really almost have no pain. Like it's a little sore. Probably just from you.
Sore is normal. Normal for me, walking out of here, normal is looser and sore. That's normal, but no pain. Like there's a difference between soreness and pain, right?
Yeah.
How about when I push her? Is it less soreness?
It's less. Ooh, I felt that right.
Little here?
Yeah.
Okay, how about out here?
No.
How about out here?
No.
All right, we're going to do a little bit more with the massager on the massage gun on that area. You all right? We're getting what's called the paraspinal muscles. Now we're going to go down a little bit into the... It's called the QL muscle, quadratus lumborum, gluteus medius, gluteus maximus. Some people are more maximus than others. You know what I mean? Now, because you were complaining of in here in the shoulder blade, we're going to get real good release with the muscles here. What I want you to do is take your left hand, put it back here, palm up like you're half handcuffed. You know what that feels like?
Yeah.
I knew it. Me too. Don't lie. Now, relax your shoulder. Relax. I'm just going to lift it up a little bit. Yeah. See how it gets underneath? Oh, yeah. Oh, yeah. Too much? Yeah, baby. That gets that. Is that right where it is? Uh-oh. You killed my massager. All right, drop that down. Oh, yeah. You're getting a good release today, baby. All right. How's it feel now in this area that was sore? Any better? Nice. Okay. We're good here. This is a lot better. Tremendous amount better. Now I want you to, we're going to do a little more drop through the middle back and the upper back. Tighten this up. Stay relaxed. Good. Good. Nice. All right, dude. Huh?
That was a good one.
Yeah, you're feeling your body likes this. You're releasing good. Slide down about 2 inches towards your feet. Keep going. A little more, right there. Always the big guys come at the end of the day. When I'm tired. It's all right, I got you. Ah. Relax. There you go. Much better. Okay. Now, flip over on your back. Roll over, Beethoven. We're going to do a little bit in the front. We're going to do the... Yeah, I got a million of them. Wait, you know what? Let me see. There you go. Now flat down. Over the ears. Slide down a couple inches towards your feet. A little bit more. Right there. Good. Let your legs come flat. I'll extend it. Now what we're going to do... You okay?
The light right.
Oh, and I used to keep these off in just the lamps, but it's not good for the video. Bring your arms out like a T, like Jesus on the cross. And we're going to do the collarbones on both sides, and we're going to do a little bit in the rib cage. That's going to help with your upper back, too, and your neck and everything, and even breathing better, and your shoulders. Good. Turn this way. Right there. Good. Go to the other side. Good. Back in the middle. Good. Good. Now slide yourself up a little bit towards your feet. Towards your head, rather. Good. Bring them back. Okay. Now what we're going to do is I'm going to do a little tug at the knee. Should release the knee joint and maybe even more up in here. Your job, just give me a loose, floppy leg. I got the rest of it. Loose. Heavy. Heavy, loose. Let it go. Let it go. Nice. Slide up. What'd you feel?
I popped in my hip, like my back.
Nice. Slide back up so I can reset for the next one. You okay getting your toes popped?
Yeah.
One time I grabbed somebody's toes, a guy's toes, without asking, and he beat me up. No, he didn't beat me up. He shoved me. He sat up and shoved me. So now I always ask permission. Drop, loose, loose. Nice. Good ankle release. Boop. Now we do the same thing on this side. Loose and floppy leg. Loose, heavy. Heavy and relaxed. Wait, slide up again. I missed. The guru misses every once in a while, guys. Drop it. Let this one straight. Good. Relax it. There you go. All right, scoot up one more time. Good. Now we're going to do a little tug here at the ankle. Loose, heavy, drop it in my hands. Loose. There you go, good. All right, almost done. I'm lowering you down. Coming down.
That's crazy. I don't have like no tension in my body.
Dude.
I feel great.
Sit up when you're ready, face that way. That's what everybody says when they leave here. Not everybody, but a lot of people. Now, look forward. You okay?
Yeah, I'm asleep.
You be all right to drive home?
Yeah, of course.
Now, let me just look at your posture real quick because, bro, perfect. Your head is right on top of your body, whereas it should be. That's going to help a lot with your shoulders and the rest of your back. Okay, what we're going to do is finish off. We're going to adjust the shoulder joints, the elbows, the wrists, the fingers, and then we'll be good. I don't know why, but I always start on the left. So bend this one up in front. I got to hug around you, get underneath your elbow, and bop. Don't punch yourself in the face because I will laugh at you. Relax. Let it go. Good. Give me this one. Then drop the elbow down loose. Relax. Good. Coming around. Drop it in my hands. Loose. Heavy. Loose. Let it go. Okay. Relax here. Floppy. Good. Good. Relax. Relax. Pull back. Pull. Good. Whose phone's ringing? All right. Drop it here. Drop loose. Woo! Got one there. Good. Good. Loose. Pull. Got it. Done.
Appreciate you, Doc.
Yeah. Dude, I can just look in your face. I can just look at your face and know you're good.
Yes, sir.
Yeah?
Yeah.
Tell me about the lower back. Looser?
Yeah, everything. I feel fine. It's a little like soreness, but like you said, there's nothing.
Soreness is just normal part of the treatment. You might even be sore for the next 2 or 3 days.
Yeah, I don't feel pain though. You know what I'm saying? Like,
yeah. There's a difference between like injury pain and soreness, right?
Like when I came here, I felt like I couldn't even do that because of that little pinch nerve
That's,
I had. But now I feel
it's
like
better. Take a deep breath. Does it bother you?
No, sir.
Nice.
Go.
Listen, my measurements showed you did fabulous. So I'm happy for you.
I appreciate you.
If wait a few days, let your body heal and repair all the stuff that we just did. If you feel good, you're good. If you feel better, but not all the way better, and you want to go for more, my best recommendation, come back next week. We'll do another one if you can. That's the best recommendation. If you can't do the best, then try 2 weeks. And as long as you get back here within 2 or 3 weeks, we can still move you forward. If you wait too long, you'll drift backwards a little bit, you know, and then we got to do that seesaw thing. Any questions? Did I ask you that already? Yeah. All right. So it was an honor to serve you. Let's say goodbye to the people out there, and then we'll finish up. Guru Chiropractor, peace and love. Big Jonathan, doing a hell of a lot better.
Yes, sir.
If you're looking for some of this, if you're watching this and you're like, damn, that looked like something I probably need, go with your gut, go with your instincts. It probably is. It's very relatable visually. And if you're within the tri-state area, New York, New Jersey, Pennsylvania, I'm even pulling from Maryland now, Connecticut, and, Massachusetts even. People coming down from Boston for little old me. If you want to take the drive, even if you want to fly in, heck, I'll take good care of you. The best way to find me and reach out is on my website, retrochiropractic.com. There's a book now link. There's a whole bunch of info on there. You want to find out more about me? That's the best way to do it, or watch some of my full-length videos on YouTube at Guru Chiropractor. If you feel like this is what you need, it probably is. And if I'm your guy and close enough for you to come on through and I'll do my very best for you. I love and appreciate everybody. This is my life. It's coming from my heart, not just because it's a business. And I will do my very best if you come through, I promise. Love everybody. Peace and love.